Yeah, due to the time, I think we're going to move on and continue now to our final speaker, last but certainly not least. And our final speaker is Anđele Radovanović. And it's a pleasure to introduce you to an active IF member, another active IF member, or Anđele. And Anđele is a program manager also at the Association of Youth with Disabilities of Montenegro. And Anđele is an active member where she has for the past years worked with us as a trainer for IF's annual human rights and advocacy training for youth with Spina Bifida and Hydrocephalus, where she helped to train future SBH advocate leaders. On that note, Anđele will talk about an inclusive model of health. Please, Anđele, the floor is yours.
So, dear ladies and gentlemen, good afternoon, and I'm so sorry for these technical issues. I'm really pleased to be taking part at this event today. And as a person with spina bifida, I consider it very important to talk about health and other issues we are covering today in context of human rights. We all know that CRPD was adopted more than 15 years ago, but we are still faced with lack of understanding of some basic points of view that prevent our equal participation in the life of the world. Long-term application of medical model of approach to disability has caused one of the biggest barriers we are having today, the lack of difference between disability and illness in numerous areas, including in the healthcare. Therefore, we remain being seen as patients through the whole life, regardless of the fact that right to health, as prescribed in the Article 25 of the CRPD, is our human right, nothing more and nothing less. Being born with an impairment that would require medical intervention at the beginning of the life, such as SBH, and maybe have more contact and influence of medical staff on our lives, should not overcome the fact that our impairment is not the only thing that defines us. Disability in human rights-based model of approach is result of interaction between impairment, as SBH, and barriers we are facing. Looking at the support that is being provided to persons with SBH, we can see that children with SBH can get health care and support in the early age, including availability of intervention, physical therapy, medical aids, and so on. Some support in many areas of the world is a dream for persons with SBH and their families. In some smaller and poorer areas, and if we take into account that spina bifida and hydrocephalus are rare impairments, lack of specialists on the local level, but also on the national level is obvious, and it is affecting not only children and adults with SBH, but also their families. Very often, support is available only in the big centers, in the countries, and even in the other countries, which is violation of the Article 25 Part C that prescribes availability of healthcare as close as possible to people's own communities, including in rural areas. We must be sure that SBH is not only an issue of an individual with spina bifida and hydrocephalus. It is issue of its family, of its friends, of doctors working in the SBH field. It is an issue of the whole community that should work together to ensure that high-quality healthcare is provided to every person with spina bifida and hydrocephalus anywhere in the world. Therefore, we must make sure that multidisciplinary care should be provided not only to persons with disabilities, but also to their families, who are the main source of support through the life of persons with SBH and who facilitate their transition into adulthood. And when we are coming from childhood to adulthood, persons with spina bifida and hydrocephalus are facing a new challenge in this period of life. Lack of specialists for adults with SBH, and who also are facing lack of multidisciplinary teams and clinics where they can go and get a quality healthcare. Then they are forced to visit pediatric units and clinics as adults, and they face possible discrimination and lack of understanding, but they are left without any choice to do anything else. Good and quality healthcare in the childhood and adulthood period is also a precondition for a quality transition to older age and for maintaining independence and good state of health in the older age, when consequences of impairment, as my colleague Kevin spoke before, can be more visible and some barriers become harder to overcome without proper care and support. On the policy level, if we start working together, we can achieve a lot. First of all, we should work toward provision of universal health coverage for all persons with SBH in their place of living, regardless of their age, color, race, nationality. After that, we could work towards establishment of multidisciplinary teams on the national level that would provide all persons with spina bifida and hydrocephalus quality health care in line with Article 25 as close as possible to their communities. Therefore, numerous legislative changes to strengthen disability rights and protect against discrimination are needed. We need laws that will not discriminate us only on the basis of disability or that would restrict our other rights and provide only health care. And the last but not the least important, all these changes cannot be done without us. We need full, efficient, and meaningful involvement of persons with disabilities and their representative organizations, such as National Spina Bifida and Hydrocephalus associations, in the policy and decision-making process for healthcare, as this is the only way to mainstream disability in the healthcare as a human rights issue. Thank you.
Thank you so much, Angela, for sharing your perspectives and also clear actions of what people can do to get inspired and to get active. Do you have perhaps some clear guidance for the youth specifically, because you have so much experience with that? Is it something that the youth can form networks, or should they work with the member associations directly? What are your recommendations?
Well, the main point which is important for youth inclusion in decision-making is to start being active in national associations, because that national level is maybe the thing we know the best and where we can act to see the changes we want to see. So we want to see more active young people with spina bifida working with their national associations, with their doctors, with their decision makers, with politicians, so we can have that inclusive approach to disability. Because as long as we are not talking about our rights, and without young people with disabilities being included, we will have other people making decisions instead of us.
Fantastic. And I see in the chat there's a question. Perhaps you would like to address it in the Q&A, because it seems that you inspire people that want to be active. So thank you so much for bringing that to us, and yeah, to get more commitments going on and strong. Thank you so much, Angela.
Thank you.